Baxter Elastomeric Intermate System, administration by Caregiver. Preparing for the infusion. Remove the Baxter Elastomeric Intermate from the refrigerator approximately 3 hours before the scheduled infusion. If the elastomeric is cold, the infusion may infuse slower than expected, increasing the time for the infusion. Inspect the device for the following. Review the label for accuracy. Right name, right drug. Dry outer shell with no leaking observed. Medication in the reservoir should be clear with no visible particles present. Air bubbles should be pea-sized or smaller. If any discrepancies are noted, set the device aside and notify the pharmacy and visually inspect another device for infusion. Prepare the infusion area. Locate and clear an area for the infusion. Clean the work area and have the caregiver clean their hands. Wash hands and wrists for 15 to 30 seconds. Rinse hands with fingers pointing down. Dry hands using a clean paper or cloth towel. Gather and organize supplies. Normal saline flush syringes. Antiseptic wipes. Baxter Elastomeric Intermate. Administering the infusion with the help of a caregiver. Clean the needleless connector using the antiseptic wipe for 15 to 30 seconds using friction. Wait for the antiseptic to dry. Flush the IV by connecting the normal saline syringe to the needleless connector using a push and clockwise twisting motion. Open any clamps on the vascular access device and flush as directed. After flushing, close any clamps you opened and remove the syringe while holding the needleless connector using a counterclockwise turning motion. Clean the needleless connector using the antiseptic wipe for 15 to 30 seconds using friction. Wait for the antiseptic to dry. Remove the cap from the Baxter Elastomeric Intermate and connect to the needleless connector by pushing and twisting in a clockwise motion. Open any clamps on the vascular access device and Baxter Elastomeric device if present. During the infusion, place the Baxter Elastomeric device on a flat surface away from any sources of heat, radiator, fireplace, stove. Keep the Baxter Elastomeric Intermate level with your vascular access device. Although not necessary, a pouch may also be available through your pharmacy to further facilitate mobility. Monitor the infusion time. The nurse or pharmacist will instruct you on the total length of time for your infusion. Wait for that time to pass. Ensure the medication has completely infused before disconnecting. Disconnecting the infusion. When the infusion is complete, close the clamps on the Baxter Elastomeric Intermate tubing and vascular access device if present. Disconnect the Baxter Elastomeric Intermate by holding the needleless connector and twisting in a counterclockwise motion. Wash hands and wrists thoroughly for 15 to 30 seconds. Clean the needleless connector with the antiseptic wipe for 15 to 30 seconds using friction. Wait for the antiseptic to dry. Connect the normal saline flush syringe to the needleless connector using a push and clockwise twisting motion. Open any clamps present on your vascular access device and flush as directed. Close any clamps present on your vascular access device and remove the syringe while holding the needleless connector using a counterclockwise twisting motion. Dispose of the Baxter Elastomeric Intermate and other supplies as directed by your healthcare provider.